Sentinel lymph node biopsy in breast cancer patients. Breast cancer is one of the frequently diagnosed cancer and leading cause of cancer death among females worldwide and Bangladesh as well. For breast cancer patients, the status of axillary lymph node is one of the utmost crucial prognostic factors. Though axillary lymph node dissection is gold standard to evaluate axilla, but it is associated with lots of complications. In patients with early-stage node-negative breast cancer, without compromising the precision of diagnosis or the predictive data, sentinel lymph node biopsy staging can lessen the morbidity and complications. Several methods have been emerged to trace the sentinel nodes, which includes blue dye, radioisotope, indocyanine green, fluorescent, etc. Now, what is the rationale behind doing this study? There is a huge burden of breast cancer patients in Bangladesh, and for patients with early-stage node-negative breast cancer, sentinel lymph node biopsy remains the standard of care. Identification of sentinel node can be achieved by a variety of techniques, using each technique alone or combination. On the other hand, in Bangladesh, there are insufficient studies related to SLNB as well. So this study would help to compare between single and dual tracer techniques in sentinel lymph node biopsy in breast cancer patients at National Institute of Cancer Research and Hospital regarding their socio-demographic and clinical characteristics. To the best of my knowledge, this was the first comparative study regarding SLNB techniques at NICRH and in Bangladesh as well. Now, hypothesis. So the hypothesis was dual tracer technique would be superior than single tracer technique in terms of sentinel lymph node identification rate, identification of metastatic sentinel node, and false negative rate in sentinel lymph node biopsy in breast cancer patients. The general objective was to compare between single tracer and dual tracer techniques in SLNB in breast cancer patients. And specific objectives were to determine and compare sentinel lymph node identification rate between single tracer and dual tracer techniques, and to find out and compare the identification of metastatic sentinel node by both of the techniques, to measure and compare false negative rate between both arms, and to address the demographic characteristics of the patients. These were the operational definitions. Now come to materials and method. It was a quasi-experimental study which took place in the Department of Surgical Oncology, NICRH, that took place from January 2023 to June 2024. And the study population were patients with histopathologically proven early-stage node-negative breast cancers and selected for SLNB. Sampling method was purposive sampling technique, and sample size was 68 patients were recruited, and both were distributed in 2 arms, 34 in each arm. Arm A received dual tracer, that is methylene blue dye combined with radioactive tracer in SLNB. On the other hand, arm B received single tracer, that is only methylene blue dye during SLNB. Now for inclusion criteria, histopathologically proven breast cancer, early stage node-negative breast cancer patients selected for SLNB were included in this study. And as for exclusion criteria, pregnant patient, patient with multicentric and multifocal tumor, patient with a history of previous surgery in breast or axilla, patient with a history of prior neoadjuvant chemotherapy or radiotherapy were excluded from this study. Now the procedure in short. For arm A, on the day before surgery, patients were administered radioisotope intradermally at the periareolar region, and lymphoscintigraphy was performed immediately at the Nuclear Medicine Center under the Atomic Commission. And on the day of surgery, after induction of general anesthesia, 10 minutes prior to incision, 1% methylene blue dye, at least 3 ml, was injected intradermally at the periareolar region. And sentinel lymph node were identified by visual detection of blue dye in nodes or lymphatic channels, along with intraoperative detection of radioactivity with handheld gamma probe of technetium-99 that is navigated from USA. And lymph nodes were considered sentinel node when they were blue, radioactive, or both, and harvested when identified. And as for arm B, after induction of general anesthesia, only 1% methylene blue was injected and blue nodes were searched and harvested when identified. This is the study flowchart. Now come to the results and observation. So you can see that majority of the patients and both arms belong to the age group of 51 to 60 years of age. And this table is showing distribution of the study population according to the socio-demographic characteristics. And these two pie charts showing that majority of the patients in both arms were postmenopausal. And table showing distribution of the study patients according to the risk factors for the development of breast cancers. In majority cases, 3 lymph nodes are identified. On the other hand, with single tracer, 2 nodes are identified, and the difference between two arms was notable. This is another chart that is showing the total number of sentinel lymph nodes identified. That is 117 with dual tracer, and it is 59 with single tracer, and the difference was significant. Now, sentinel lymph node identification rate, it was 82.35% with single tracer. On the other hand, it was 100% with dual tracer technique. And this is line chart is showing the number of the sentinel lymph node harvested. The mean with dual tracer is 3.71 and with single tracer it is 3.03, and the difference was notable. And this is a donut pie chart. So it's showing the sentinel lymph node metastasis. The inner circle indicates the dual tracer and the outer circle indicates the single tracer. We can see that majority cases sentinel lymph node metastasis was identified by dual tracer. And number of metastatic sentinel lymph node identified, the mean was with dual tracer 1.15. On the other hand, it was 0.38 with single tracer. Now this pie chart showing the sensitivity of sentinel lymph node biopsy with single tracer is 78% and it is 95% with dual tracer technique. And false negative rate of sentinel lymph node biopsy is 22% with single tracer. On the other hand, it is only 5% with dual tracer technique. Table showing distribution of the study patients according to the type of axillary surgery. And this table showing distribution of the study patients according to the acute toxicity. And the difference between two arms was not statistically significant. So now come to the conclusion. Dual tracer technique is superior than single tracer technique in sentinel lymph node biopsy in breast cancer patients in terms of sentinel lymph node identification rate, identification of metastatic sentinel node, and false negative rate. So these are some pictures showing different parts of the Dialon Navigator handheld gamma probe system, and some visuals of the procedure. We can see the radio tracer in insulin syringe, and SPECT CT was done after the injection of the radio tracer, and this is the picture of the lymphoscintigraphy image. Some other pictures, this is the methylene blue dye. We can see the procedure is going on. We can see the blue dye and blue lymphatics. And this is the gamma probe, and we can see the monitor showing the radioactivity that is in vivo and in vitro. Now, the take-home message. So it is a better option to perform dual tracer technique in sentinel lymph node biopsy in breast cancer patients if facilities are available. So thank you so much for your patient hearing.
Thank you, Dr. Tanzina Bhuiyan, for